So Tigroid pattern on the MRI or stripe sign or leopard skin sign is a linear hypointensity on radiating from the periventricular margins and the centrum semi-ovale and T2 images on the MRI. The sign represents a specific pattern of hypomyelination or demyelination with the sparing of the perivascular white matter, as you can see here, and the spared perivascular white matter appears as dots or stripes. Again, it's the bright T2 signal of the affected white matter, giving the appearance of leopard skin sign or tiger stripes, according to your imagination. It's commonly seen in metachromatic leukodystrophy, and usually there's no enhancement of brain tissue, unlike in adrenal leukodystrophy, which is another type of white matter changes, a leukodystrophy pattern. However, some cranial nerve enhancement has been reported in MLD. So MLD is an autosomal recessive disorder, and usually the gene mutation is ARCA gene or PSAP gene, and it's affecting the aryl sulfatase enzyme with deficiency, leading to accumulation of sulfatide in the brain and peripheral nerves or other organs such as kidneys, liver, and gallbladder. MLD usually has three phenotypes: late infantile or juvenile and adulthood onset. The late infantile is the more common type and is usually present between 12 to 18 months of age. Clinically, it manifests like a peripheral neuropathy with changes in intellect, speech, coordination. Adult onset usually heralded by cognitive decline / dementia, behavioral difficulties. Usually, the nature of the disease is progressive with gait abnormalities and quadriplegia and separation and death, usually 6 months to 4 years. It's usually confirmed by finding low levels of aryl sulfatase in peripheral white cell count and urine. And 70% of cases, MRI shows an increased signal in the periventricular white matter with initial sparing of subcortical U fibers and the perivascular white matter sparing. CSF is normally acellular with raised protein and is usually supportive for diagnosis. There's no curative treatment, but stem cell transplantation has shown some slow progression. Other differential for the Tigroid pattern, some cases have been reported in ADAM, Blazes-Merzbacher disease, which is a leukodystrophy, and glucoid cell leukodystrophy, and autosomal recessive spastic ataxia of Charlevoix, and JM1 gangliosidosis.